All right, gentlemen, let's talk honestly for a moment. If your energy, confidence, or performance isn't what it used to be, and especially if erections aren't as strong, as reliable, or as frequent as before, this conversation is for you. I'm Dr. Olivia Parker, and for years I've worked with men dealing with declining testosterone, reduced blood flow, and erectile dysfunction. And one thing I can tell you with absolute certainty is this: most men are not broken. They're undernourished at a cellular level. Testosterone and healthy erections don't depend on motivation or willpower. They depend on very specific biological systems working properly: hormones, blood vessels, nerves, and cellular energy. And those systems rely heavily on the right vitamins. Today, I'm going to break down the top 3 vitamins that play a critical role in testosterone production, erection strength, and male vitality. These are not magic pills, but when your body is deficient in them, and most men over 40 are, performance suffers. Let's start with the most important one: vitamin D. Vitamin D is not just a vitamin. It functions like a hormone in the male body. Testosterone-producing cells in the testes actually have vitamin D receptors. When vitamin D levels are low, testosterone production drops. Period. Multiple studies have shown that men with higher vitamin D levels consistently have higher total and free testosterone. On the flip side, men deficient in vitamin D are far more likely to experience low libido, weak erections, fatigue, and mood changes. But testosterone is only part of the story. Vitamin D also plays a major role in endothelial health, the inner lining of your blood vessels. Erections are a blood flow event. If blood vessels don't relax and expand properly, erections suffer no matter how strong desire is. Low vitamin D is strongly linked to endothelial dysfunction, which means reduced nitric oxide production. Nitric oxide is the molecule that tells blood vessels to open. Without it, blood flow to the penis is limited. That's why men with low vitamin D often experience erectile dysfunction, even when testosterone looks normal on paper. The problem is that most men don't get enough vitamin D anymore. We spend more time indoors, use sunscreen constantly, and as we age, our skin becomes less efficient at producing vitamin D from sunlight. For most men, supplementation becomes necessary. Blood levels matter more than dose, but consistently maintaining healthy vitamin D levels supports testosterone, circulation, and overall vitality. Now let's move to the second vitamin, one that directly impacts erection quality: vitamin B3, also known as niacin. Niacin is one of the most underrated vitamins for erectile health. It plays a key role in energy metabolism, nerve signaling, and most importantly, blood vessel dilation. Niacin helps increase nitric oxide availability and improves endothelial function. In simple terms, it helps blood vessels relax and stay open longer. That's exactly what's required for strong, sustained erections. In fact, clinical studies have shown that men with moderate to severe erectile dysfunction experienced significant improvement when niacin levels were corrected, especially men with underlying circulation issues. Niacin also supports cholesterol balance. Why does that matter? Because plaque buildup in arteries restricts blood flow. The penile arteries are very small, much smaller than coronary arteries, which means erectile dysfunction often appears years before heart disease symptoms. Niacin supports healthier blood flow by improving lipid profiles and reducing vascular inflammation. There's also a neurological component. Erections require proper nerve signaling from the brain to the pelvis. Niacin supports nerve health and energy production inside nerve cells, helping signals travel more efficiently. Now, a quick but important note. High-dose niacin should only be used under medical supervision, as it can cause flushing and affect liver function. But adequate vitamin B3 intake through diet or appropriate supplementation plays a meaningful role in erectile performance. Now let's talk about the third vitamin, one most men have heard of, but few truly understand: vitamin E. Vitamin E is a powerful antioxidant, and that matters deeply for testosterone and erectile function. Testosterone-producing cells are extremely sensitive to oxidative stress. As men age, oxidative damage increases due to stress, inflammation, poor diet, lack of sleep, and environmental toxins. When oxidative stress overwhelms the testes, testosterone production drops. Vitamin E helps protect these cells from damage, allowing them to function more efficiently. But its benefits don't stop there. Vitamin E improves blood flow by protecting nitric oxide from being destroyed by free radicals. Nitric oxide is fragile. Oxidative stress neutralizes it quickly. Vitamin E helps preserve nitric oxide so blood vessels can remain relaxed and responsive. This is one reason vitamin E has been associated with improved erection quality in men with vascular-related erectile dysfunction. Vitamin E also supports sperm health, libido, and overall reproductive function. Historically, it was even referred to as the fertility vitamin because of its role in reproductive tissue health. However, quality matters. Vitamin E should come from mixed tocopherols and tocotrienols rather than synthetic forms. Balance is key. More is not always better. Now, here's the most important thing I want you to understand. No single vitamin fixes erectile dysfunction or low testosterone on its own. These vitamins work together as part of a system. Testosterone production, blood flow, nerve signaling, and cellular energy are all interconnected. When vitamin D is low, hormones suffer. When B vitamins are low, circulation and nerves suffer. When antioxidants like vitamin E are low, tissues age faster and nitric oxide disappears. That's why many men feel stuck. They treat symptoms instead of restoring the foundation. And let me be very clear about something. If you are experiencing persistent erectile dysfunction, fatigue, or low libido, that is not a personal failure. It is often an early warning sign of deeper metabolic or vascular issues. Addressing vitamin deficiencies is not alternative medicine. It is basic physiological support. These vitamins don't work overnight. They work gradually, quietly, and sustainably by restoring what aging slowly depletes. The men who see the best results are the ones who stay consistent, improve diet, manage stress, sleep better, and support their bodies instead of fighting them. You are not too old. You are not broken. Your body is responding to years of accumulated stress and nutrient depletion. When you give it what it needs, it often responds remarkably well. This is Dr. Olivia Parker reminding you that strength, confidence, and masculine vitality are not lost with age. They are supported through informed choices. Stay strong, gentlemen.